Ryan.
Hello.
My name is Cheryl. I'm going to be your nurse today, and I just need to perform a quick head-to-toe assessment on you. Is that okay?
Yes.
All right. Can you confirm your date of birth for me?
June 6, 1973.
All right. And do you know where you're at today, Ryan?
Yeah, I'm in a hospital.
Okay. And do you have any allergies?
No.
Okay. So I would raise the head of the bed, or I would raise the bed to a working height, perform hand hygiene, and provide privacy. And I'm just going to put on some gloves. And I will move from basically just from your head down to your feet, checking all your systems and the integrity of your skin, okay?
Okay.
Okay. Okay. So we'll start up here. So I'm going to take a look at your eyes, and I'll make sure that the pupils are round, reactive to light, equal, and that they accommodate. Good. And look at the tip of my pen light. Perfect. And if you could just press on my hand, other side. That's good. And have you noticed any sores in your mouth at all?
No.
Okay, can I see? Perfect. And do you wear glasses, Ryan?
Yes.
Are those for reading, or do you wear them all the time?
All the time.
Okay, and do you have dentures?
No.
Okay, so I'm going to just move down the body. I want to check for skin turgor by pinching up on the clavicle and checking for the skin to rebound. And now I'm going to check, I'm going to listen to your heart, Ryan. And I'm listening for rate, rhythm, amplitude, and any abnormal sounds. And that sounds good. All right, and I'm gonna move my way down the arm, checking for edema. And then I'm gonna check the radial pulses bilaterally. It's good. And then I'll check for cap refill. It's good. And can you push down on my hands? Oh, perfect. All right. So we're going to talk a little bit about your diet and your hydration. So how many times do you eat per day?
About 3.
Okay. And do you usually finish your meals?
Yes.
And so how many times a day do you have a bowel movement?
2.
About 2. And can you describe that? Is it formed? Is it loose?
Formed.
Okay. And how about hydration? How much do you drink per day?
A few liters of water, I guess.
Okay, and you urinate, how many times do you urinate?
Every couple hours.
And do you ever experience any burning when you urinate?
Nope.
And can you describe that to me? Is it the color?
Clear.
And is there any odor?
No.
And when you go to the restroom, do you usually get there on time?
Yes.
Okay, for both bowel and bladder?
Yes.
Perfect. All right, I'm going to assess the client's abdomen, and I will look for any distension. And at this time, I would also be assessing the skin for any breakdown. And then I'm going to listen to all 4 quadrants for vowel sounds. Good. And have you had any tenderness or pain in your abdomen?
No.
So is it okay if I palpate?
Mm-hmm.
Okay. And let me know if you have any tenderness as I do this. Good?
Good.
All right. And at this time, I would ask the client if I could look at their bottom and their peri area to check for any skin breakdown. And I would move down the legs, checking for edema as I go and checking the integrity of the skin. and checking for edema from the knees to the ankles. I would check the posterior tibial pulses bilaterally. I would check the pedal pulses bilaterally. And then I'm going to check for cap refill. Good. And I'm going to pay attention to the soles of the feet, looking for any break in the skin, and that looks good. All right, now I'm going to take a listen to your lungs. Have you been experiencing any shortness of breath? Have you been experiencing any shortness of breath?
No.
Okay. And have you had a cough at all?
No.
All right. So I'm just going to listen to your lungs. And if you could just take a deep breath in for me. And again. 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 If you could roll over for me. And just a deep breath in for me. Again. Okay, good. And I forgot to ask you, have you been experiencing any numbness or tingling in your hands or your feet?
Yeah, my feet.
Okay. And we're just going to check the strength in your feet. Can you push up on my hands? Perfect. Down. All right. And I would assess further to see where the tingling starts and ends, and I would document all of my findings. So is there anything else I can do for you today, Ryan?
No.
Okay, I would lower the bed to its lowest position. I would give the patient the call light, and I would make sure the room is free of clutter, and fill their water pitcher, and document all of my findings.